Hello, this is Dr. Ruby and welcome to the first lecture for Module 8, Functional Anatomy of the Cervical Spine. In this lecture we will just go over some of the muscles or most of the muscles in the cervical spine area and talk about their functions. We'll start with the sternocleidomastoid. It originates in two locations, the sternal head and the clavicular head, one at the top of the manubrium and the other at the medial one-third of the clavicle. It then inserts on the mastoid process of the lateral superior nuchal line of the occiput. It's a very long muscle. The isolated functions of the sternocleidomastoid are that it assists in a concentric contraction or acceleration of lateral flexion of the cervical spine. It also assists in acceleration of cervical rotation and cervical flexion. Its integrated functions include assisting in eccentric deceleration of lateral flexion, cervical rotation, and cervical extension. The sternocleidomastoid is also a dynamic stabilizer of the cervical spine. There are several portions of scalenes. We have the anterior portion, which you can see in this photo, and the middle portion, and the posterior portion. The isolated functions of the scalenes are that they assist in concentric acceleration of lateral flexion, cervical rotation, and rib elevation. This rib elevation occurs during inhalation. The anterior scalene assists in concentric acceleration of cervical flexion. The integrated function of all the scalenes is that they assist in eccentric deceleration of lateral flexion, cervical rotation, and deceleration of cervical extension. They assist in dynamically stabilizing the cervical spine. The longus colli. The isolated functions of the longus colli are that they assist in eccentric acceleration of cervical flexion. They assist in concentric acceleration of lateral flexion. The integrated function is that they assist in eccentric deceleration of cervical extension and lateral extension. They also assist in eccentric deceleration of contralateral rotation, and of course they assist in dynamic stabilization of the cervical spine. The longus capitis. The isolated function of the longus capitis is that it assists in concentric acceleration of cervical flexion. The integrated function, of course, is to eccentrically decelerate cervical extension, and they are dynamic stabilizers of the cervical spine. The splenius capitis. The isolated function of the splenius capitis is that it assists in concentric acceleration of ipsilateral rotation, that's same side rotation. Also in concentric acceleration of cervical spine lateral flexion and cervical spine extension. The integrated function of the splenius capitis is that it assists in eccentric deceleration of contralateral rotation, so that's opposite rotation. It assists in eccentric deceleration of lateral extension of the cervical spine and deceleration of cervical flexion. Overall, it assists in the dynamic stabilization of the cervical spine. The splenius cervicus. The isolated function of the splenius cervicus is that it assists in concentric acceleration of same-side rotation, or ipsilateral rotation, as well as acceleration of cervical spine lateral flexion and cervical spine extension. The integrated functions are that it assists in eccentric deceleration of contralateral rotation and deceleration of lateral extension, as well as deceleration of flexion. Again, the splenius cervicus assists in dynamic stabilization of the cervical spine. The rectus capitis posterior, major and minor. These are very small muscles. The isolated function of both of the major and minor muscles are that they assist in concentric acceleration of extension of the cervical spine and in acceleration of ipsilateral rotation of the cervical spine. The integrated function for both is that they assist in eccentric deceleration of cervical flexion and eccentric deceleration of contralateral rotation of the cervical spine. They assist in dynamic stabilization of the upper cervical spine. The oblique capitis superior. The oblique capitis superior's isolated function is to assist in concentric acceleration of cervical extension. The integrated function is that it assists in eccentric deceleration of cervical flexion and it is a dynamic stabilizer of the cervical spine. The oblique capitis inferior. The oblique capitis inferior's isolated function is to assist in concentric acceleration of same-side rotation of the cervical spine. The integrated function is that it assists in eccentric deceleration of opposite side rotation of the cervical spine, and it assists in dynamic stabilization of the cervical spine. This concludes the review of the muscles that we will talk about. Please move on to the second lecture on forward head posture.